Tetracycline are antimicrobial antibiotics that inhibit bacterial ribosomes, which are the organelles that make proteins. Tetracycline were originally derived from the soil-dwelling Streptomyces bacteria. They get their name from the structure, which involves four rings bound together. So tetra for four and cyclines mean rings. Moving towards the mechanism of action. So the tetracycline works so binds to the east side on the 30S subunit of the bacterial ribosome, which inhibits the binding of classification of tetracyclines to the messenger RNA. Tetracyclines are divided according to their duration shut down protein sensitive to actin even begins like tetracycline itself have a half-life of around 8 hours, and long-acting ones like doxycycline and mindrocycline last for 16 hours or more. Some bacteria developed enzymes that can break down tetracyclines, or they have proteins on their membrane that could pump the medication out. Glycyl cyclines like tetracycline are modified tetracycline which are extra dimethyl glycyl amidacyl chain. This prevents them from binding to bacterial proteins and enzymes, so they can overcome bacterial resistance. Now let us discuss the pharmacokinetics of tetracycline. Administration of tetracycline is usually topical or perioral, but tigecycline is used for only. If used perioderally. Tetracycline should not be taken with food because they directly bind with the magnesium, iron, aluminum and calcium, and the resulting molecule is then unable to be absorbed. This is why tetracycline are not given to patients on iron and calcium, as well as antithesis, which can contain aluminum salt. Now let us discuss the clinical indications for when the tetracycline can be prescribed or taken. So tetracyclines are broad spectrum, meaning they can target a wide variety of gram-positive and negative bacteria. They are often used to treat severe acne or community-acquired pneumonia. Tetracyclines also tend to accumulate within human cells, which make them useful to treat intracellular pathogens like mycoplasma pneumonia. It can also be given to prevent malaria, which is parasitic protozoa that infects blood cells and hepatocytes. Both doxycycline and tigecycline are also effective against MRSA, a notoriously tough bug that resists many common antibiotics. You must always remember that while learning about any kind of medication, you must always be aware of their side effects. For side effects, tetracyclines cause phototoxicity, where patients are much more likely to get sunburnt, and tinnitus or ringing in the ear. They can also accumulate in teeth and bones, which cause permanent discoloration of the teeth and the delay in bone growth. This is particularly important in children under 8 years of age and in pregnant or breastfeeding women, where these medications are contraindicated. Metabolic products of tetracycline are nephrotoxic and can cause Fanconi syndrome, where there is inadequate reabsorption in the proximal renal tubules. Tetracycline are also not very shelf stable, and using them after their expiration date can cause liver failure. Now, in the end of this video, let's talk about some counseling points that you should consider while giving or taking tetracyclines. Number 1. This medication can make your skin more sensitive to the sun and you can burn more easily. Use sunscreen, wear protective clothing and avoid the sun. Number 2. Take with a full glass of water and stay upright for 30 minutes to avoid gastrointestinal irritation. Number 3. This medication should be taken twice daily, 1 to 2 hours before or 4 to 6 hours after antithesis. Vitamins, magnesium, calcium, iron, zinc, dairy products or bismuth subsalicate. Number 4. Do not use this medication if you are pregnant. If you could become pregnant or if you are breastfeeding. Number 4. Do not use this medication if you are pregnant, if you could become pregnant or if you are breastfeeding. So that's all for today. I hope you liked the video. Please like and subscribe on our video and keep watching.